friends of Buzzy. We have heard from many people that the people on their ward are not using Buzzy correctly, or they're not entirely sure how to use Buzzy. So because I'm going to Proza in Maastricht, Netherlands in 2 weeks, we decided to make a training poster that can be put up in your lab or in your office where you're getting your vaccines ready, or even at home, to help you remember with no words you have to interpret how to use Buzzy. So I'm going to go through our awesome new poster and show exactly what the steps are to use Buzzy properly. So if anybody else tells you it's not the right way, you can say, actually. All right, so what Buzzy is doing is threefold. The first thing it's doing is it's creating something called gait control, where you're stimulating the nerves like when you rub a bumped elbow, which means that if you want to block pain, you need to be in the same nerve area that the poke is. So that's one thing we're doing. The second thing we're doing is we're using ice, and depending on whether you use it for a little bit of time where it helps a little, or a pretty big amount of time where it helps a lot, the ice still is a totally different pain pathway, and that helps. The third thing that sometimes we're doing is giving someone some control over what happens. It turns out that pain is processed in the area of the brain that decides cognitive conflict. It figures out how to solve a problem. So if the problem is pain and you give someone some control over the pain, then their anterior cingulate cortex is like, okay, we've got this, we're going to be fine. So without more ado, let's start with how you use your Buzzy. All right, so first of all, you're going to want to put the ice wings in the freezer. And the best way to do that is to fold them, because if you fold them first and then put them in the freezer for about 30 minutes, when they come out, the shape of them is going to make it easier to curve around your body. Next thing you do, this depends on what kind of Buzzy you have. So if you have an XL Buzzy, it's going to have a strap on the back. You're going to take the ice pack and you're going to put it under the strap, like that. Now, you do not want to put it vertically like this, because if you do, eventually you're going to snap the strap, especially when it's frozen solid. I actually did that on camera once. Very embarrassing. So put it below the strap horizontally so you can see the wings like this. Now, if you have a healthcare mini, such as this, then you're going to have some healthcare wings. And then what you're going to do is you're going to take the little hole and put it on the edge. So there's some situations where the mini is easier to use. Because it's hooked on this, if you slide it, it's going to come off. And so the mini with the ice pack on it is better if someone's holding it themselves and not moving it around. If you're going to move something around, the XL's better, because the ice packs are going to stay firmly in here. All right, so moving on to our next phase. So we've gotten the ice packs on the back of the different kinds of Buzzies. Now's the situation when you turn it on before you're ready to use it. So either you're going to switch that little toggle switch, in which case the unit is going to just stay on until you turn it off, or you're going to press the button. Sometimes you have to press it real hard, and then it goes on. If it has a press button, it will turn off by itself. If it has a toggle switch, you need to do that. All right, I'm going to go now and just talk about the intramuscular or the subcutaneous. We're largely talking shots here. And depending on where on the body it is, there's different ways to do it. Now, everywhere on the body, you're going to want to leave it in place for about 30 seconds, because when you're poking in with an intramuscular or a sub-Q, it's going to go a little bit deeper. This means you need the ice to have a chance to ramp up its pain medicine numbing, and you also want to be able to get the area numbed. So to numb the nerves well, that's when you want to have about 30 to 60 seconds. So on your poster, we're right here. There you go. So you've got it buzzing and turned on. You put it where it's going to go. And then you wait 30 to 60 seconds. Now, if it's really painful, like an HPV vaccine or something that really burns a lot, then you can go up to 2 minutes. After 2 minutes, you're really not going to get much increased bang for your buck. So, all right, let's take your Buzzy. So you've got it on your deltoid. Now you want to make sure that it's actually on the area where the injection is going to be. Now you can either have the patient hold it themselves, you can use the tourniquet, just like that. Just easier when you got 2 hands. There you go. You can use that. Or what you can do is you can do something called position of comfort, and a friend who comes with the person puts their arm around. And so the person's sitting right here, and so you have a nice little sympathetic arm around, and you're holding it in the right spot. Okay, 30 to 60 seconds. And make sure someone who knows where to give shots has verified that that's the right spot. Then you're going to slide it up just as close as you can to where the injection's going to be. And then they can clean it and go. So what we like to say is 3 rules. Numb the nerves, put Buzzy between the brain and the pain, and then put the shot near the dot. So you see that all of our Buzzies come with a little indentation. All it does is let you know where the motor is that's blocking the pain. Okay, so put the shot near the dot, and then they can rub it on if they want to afterwards. This is another reason why if you're doing vaccines, the XL is a good one, because this unit is going to be able to move around without losing where your wings are. Contrary-wise, if you're doing an IV, so when you're doing a blood draw or IV access, this is where you're more likely to want to use one that does have a tourniquet. Now, if you have a healthcare unit or a little Buzzy mini, then you can put the tourniquet on top of it, so it just holds it in place. But you can still have somebody, a person, hold it themselves, or Child Life or something else. When you're doing an IV, you don't need to wait at all. It's a very superficial procedure. The vibration is 90% of the numbing. So if you want to use ice, that's fine, but if you can't get ice ready, you're only going to lose about 10% of the numbing. Now, everyone always asks, aren't you going to vasoconstrict if you use ice? Not usually. And the reason is because, so let's say we're doing an IV here. So this is where the nerves are, where the veins are. And when you put it on here, when you put the tourniquet on it, you're actually proximal. So the warm blood is flowing toward Buzzy. So since the warm blood is flowing toward Buzzy, ice is only going to make cold go through and up towards your brain and your heart. It's not going to cause the area where you're actually poking to vasoconstrict. Now, some people are really sensitive. Probably about 10% of people will vasoconstrict just because they're sensitive to it. But in general, the studies using ice have not found that there's any difference in success rates. In fact, it was 3 times more likely to be successful when they were doing Buzzy with compared to cold spray. Of course, cold spray vasoconstricts, so you know, not really a fair fight. But at any rate, you don't need to worry about vasoconstriction with the ice proximal. This is part of why you don't put it directly on. So all you're going to do is put it on while it's vibrating. Now this is an interesting thing. While you're cleaning, you may notice that you're getting some vasodilation. After about 8 to 10 seconds, you're going to see the veins pop up. And the reason, there you go, and the reason is because, you got the shot near the dot there, the reason is because Buzzy is a sympathetic stimulator. This is why Buzzy helps to decrease the fainting risk when you're doing an IV, because fainting is a parasympathetic stimulus, and so the sympathetic stimulus cancels it out. So I'm not sure why the vasodilation happens. We think it's nitric oxide release, which happens when you're fight or flight, and so you get more blood flow. Could be, but that's the hypothesis. We think that it's vasodilating because of a sympathetic response, and that sympathetic response could be local nitric oxide making the veins pop up. Either way, should be just as easier to get the IV than with a topical anesthetic. And that's all there is for IV and for IM. So IV is very fast. It doesn't take you any more time. IM, you are going to want to wait about 30 seconds to 2 minutes. So let's talk about some of the more complicated areas of the body that are that you may be doing something. Port access. Now, a port is getting access to the subclavian vein, and it's usually right about here. And so they did a study in Sweden, and what they did was they left Buzzy on for about 2 minutes, because it's a more painful thing, and then moved it, orienting it so the shot is near the dot. So moved it, as soon as they got done, they moved it into the axilla, and then clean as fast as you can and access the port. So the thing about the axilla and the nerves in the chest is that the dermatomes, the nerve pathways, are pretty close together, and they run flat. So when you're doing a port, you don't want to then move Buzzy up here or over here. You really, the nerves where this is almost always go straight into the armpit, and so then you're going to want to put it angled right there. What about if you're doing a thigh injection? So we do have videos that show kids with the dermatomes written on them in Sharpie. That was a fun photo shoot. When you're doing a thigh, what you need to know is that the nerves come out. The nerves come out from behind the spine. Let's see if we can get it to focus there. The nerves come out and kind of curve around horizontally. So I'm gonna show you a little bit, like, so the spine is where the brain is. When we say put it near the brain and the pain, the nerves are technically the brain, and it's coming out that way. So when it goes down to your legs, it's coming from your spine and then curves around over the front of your legs. So if you're giving somebody a shot in the thigh, you're not going to go directly up. You're going to go a little bit more toward the hips. So for example, let's see if I can get my hip up here. All right, so for example, I'm doing a shot right here. Buzzy, I'm going to warm him up. See, it comes off. I'm going to warm him up, and then I'm going to go lateral. I don't mean warm. I mean just like, you know, numb the nerves, and then go lateral like this. So I'm between the brain and the pain, and then do the shot right there. You want the injection to be as close as possible, but outside the area that's been cleaned. So oftentimes you can get 2 to 3 centimeters or less. You can get really close to where the shot's going to be. Now let's talk about doing a stomach injection. So a stomach injection is going to have those same nerves coming out of the spine laterally like this, like someone's reaching around to hug. So when you're doing a stomach injection, I'm going to take Buzzy. I'm going to use this one because it's going to hold its ice nicely. If you're doing it yourself and it's your Lady Buzz or your Buzzy, the ice packs have a colder side and a less cold side. This is why these can't be shared between patients, because this side can get germs and stuff over time. So you can keep it and reuse it for one patient, but you don't want to share it between people. So you take the wings, and if you're doing it on your stomach, you probably want to use the less cold side. So in that situation, I'm going to put it in like that. And what I'll do is I'll put it on wherever the injection's going to go, vibrating, and I'm going to leave it for probably only about 30 seconds. So the stomach has fewer nerves, and the amount of time you need to leave it on is likely to be less, even for some of those burning ones. So you can try and see what works for you, but you may be able to leave it on a little less long than if you're having to go straight through the meat up here or in a thigh. Once you've had it on, again, you're going to move it between the brain and the pain, and zoop, you're going to put the shot near the dot. So why don't I move it this way? Well, if I'm doing a shot here, I need the Buzzy to be on this side, because the way that the nerves come out of the spine, they go out of the spine and meet in your midline. So on the right side of your body, you want to be closer to the nerves on the back on the right. On the left side of your body, closer to the back on the right. You're not going to cross the midline in front. All right, last piece of how to use Buzzy. So if you are doing a finger stick, mechanical stimulation travels beautifully through solids. So a bone is about as solid as your body gets. So when you're doing a finger stick, you don't have to use the ice. It's really most like an IV in terms of timing and procedure. So if you're doing a finger stick, you don't need to put it directly on and then move it over. Just stick it with the shot near the dot, stick it like there, and you can actually hold it and then do the poke that way. If you're doing a digital block, same thing. If I'm going to do an injection of lidocaine right here because I need to fix their nail bed, then I'm going to take Buzzy and put it so the shot is right there next to the dot. Now, if I'm doing it this way, if I'm going to be on the meaty part of the thumb, then I probably would use the ice packs because you're going to get extra numbing. So then I'd put it on right there and then put the injection that way. So because a finger stick is not going to hurt as much and because it's so intense on the bone, that's why you can use the ice or not. I don't think it's going to make as big a deal. Probably about 10% difference. All right. So now believe that you know all of the different ways. Now the glute, if you're doing an injection of thick progesterone in oil, then I recommend you go to the link so that you can see our slides. But the gluteus and the gluteal area and the butt, the nerves are coming out of the spine up at the top, and so they're going to go around, and so again it's going to be a real diagonal where you put Buzzy closer to the base of the spine and in a diagonal from where you're doing your injection. I guess one other thing to think about is if you're doing a dental procedure. So a dental procedure, again, we're going to be on bone, so we really don't need to leave it in advance because we don't need to numb the local area. We're doing it distant from where the injection is going to be. So for bone, for dental, all of the studies have actually used ice, and most of them are going to be using the healthcare wings because you can clean these between patients. So you're going to put your wings on like that, and then you want to put the shot as close as possible to where, put the dot as close as possible to where the shot's going to be. So that means that if you're getting, say, an injection in the palate there, you want to be on the maxilla here. So put that on and then have the patient hold it. And that's pretty intense, so you really don't need to wait. They did actually a study, they call it a split mouth study. That means that they have to do shots on both sides so they can do one half one way and one the other. So they did a study with the wiggling your lip thing, and then the other one was with Buzzy. Buzzy won significantly better using the cold and vibration than the little jiggle to the jaw thing. If you are doing electrolysis, that's another situation where you want to make sure that you know where the dermatomes are. So for any kind of injection on the scalp or on the head, you've got the advantage that it's a very bony area. So your numbing and your pain relief are going to transmit really well. But depending on where the injection is, that's where you put Buzzy. So if you're doing fillers or some kind of Botox around here, go ahead and just put it laterally, because the nerves, the sensory nerves on the face go in one big area here, one area here, and one area over the top there. Interestingly, if you're doing electrolysis on the eyelash or eyebrows, then you're going to put Buzzy like this. So it's blocking those nerves that are actually coming off kind of from the top. If you have any questions about how to use Buzzy, please contact us, let us know. Now I'm going to tell you really quickly about VibraCool and how to use VibraCool. So we discovered very early that people who were giving themselves injections for their rheumatoid arthritis or diabetes or multiple sclerosis, that many of them also had pain elsewhere on their body, and they were using Buzzy for the pain. Because of that, and because of a colleague who used it to not take opioids after surgery, that's why we invented this. Now, the whole reason that we're blocking pain is that the nerves that transmit motion are 90% of what is something called gate control that blocks out pain in the spine. So this is why little electrical units that do tingling, that's more like you're just touching the top. What VibraCool and Buzzy both do is they're at the right frequency to stimulate those motion nerves like you're shaking your hand. So if you're using the units for musculoskeletal, you get a couple bonus advantages. For one thing, the same frequency that is blocking pain can also massage the muscles and separate muscle fibers. So this is really good if you have an overuse injury like tennis elbow, plantar fasciitis. But if you're going to work out and you have an IT band issue or a tight spot and you don't have time to stretch, studies have shown that using high frequency vibration for 5 minutes is equivalent to using stretching for 30 or massage for 15. So if you're in the car running to rehearsal, running to work out, and you've got a tight spot and you know you're not going to have time to stretch, you can go ahead and use this for 5 minutes. When you are about to do physical therapy, that's when you want to put on ice packs or heat packs to warm the area up. So if it's hurting before you even start, go ahead and use the ice and vibration. However, if it just feels tight and hurt, then you can use a heat pack and the vibration. You just need to make sure that either the hot pack or the cold pack are the ones that will crystallize and be solid. So because if it's squishy, it doesn't transmit the vibration, you need to make sure that that mechanical stimulation is going straight through a very thin pack. Once you have an area that is either post-physical therapy, post-surgery, painful, if you have access to the area directly, like you've been running and above your knee is killing you, just take the ice. It's going to be cold for about 20 minutes and it will melt. So as soon as it melts, if you want to keep the vibration on, take the ice pack and move it. But you're going to put this directly on the place where you hurt. So if I have a knee that's hurting, I'm going to put it directly on and then leave it on for about 20 minutes until the ice melts. You're going to get about 2 to 4 hours of relief in most cases. Your mileage may vary depending on how much pain you're in and what caused it. If you've just had surgery and you can't put this on directly where it hurts, then put it between the brain and the pain. So put it in the same dermatome, in the same nerve pathway. So if your surgery was on the back of your leg, then take this puppy and put it on the back of your leg. So if you've got leg surgery here, that's where it's going to be for the dermatome. If you have an overuse injury like plantar fasciitis or tennis elbow, golfer's elbow, then you're going to use the Easy Fit because it has a D-ring that you can put it on. Most overuse injuries are going to need to have repeated treatments before they go away for good. So at this point, while we wait for conclusive studies, what we're recommending is 20 minutes twice a day for 7 to 10 days. And so what that's going to do is you're going to have the high frequency vibration is going to separate those muscle fibers. The cold is going to decrease the inflammation, and both things together are going to decrease the pain. So if it's something that's been there for a while, it's going to take a while to get it to go away. Now once it does go away, then if it starts to flare up again, just do it 20 minutes twice a day for 1 or 2 days, and that will usually take care of it for a while. All right, I have told you very quickly everything I know about how to use these devices and our best knowledge right now of why these devices work. So go to our YouTube channel and look at all of the other specific instructional videos on how to use VibraCool pre-op, post-op, prehab, with surgeries for plantar fasciitis. Go to our Pain Care Labs channel also to see how to use Buzzy for port access, for IV access, for infant vaccines. We didn't do heel sticks, but there is a video for that. So it's going to be fun, and thank you all for watching. See you next time.